we don't necessarily need to create a new M.W.I at this campus, because really that's not what we're saying is really of need at this time if we think about what services are required. And the work that we've done with MIND England and Public Health England have shown us that stigma it can be a label that attaches itself to buildings. You know, over the years, M.W.I, of course, a lot of people remember it was called St. Brendan's. It was painted a different color. And it's been really hard still to escape the legacy piece that has come with that, if we're honest. Even our accessibility, you know, it's at the top of a hill either way to try to get to it. So from a practical standpoint, and just for so many reasons, it doesn't have to be the way that it's currently designed. As Mr. Swan's referencing, maybe it's going to be a small number of beds within this current facility, but really that's what best practice throughout the world. Psychiatric services would be attached to a general hospital, and there's no reason that you should be made to feel like it's any different or there's something wrong with having to have had a mental health challenge.
So just to clarify, so for inpatient, for people who are in, you know, an acute situation, for inpatient services, you feel that you're going to have the number of beds available when you need them?
Yes, I mean, certainly when you're planning services, you have to look at the trends. You have to look at what service you can support and ensure that you always have appropriate acute beds, because you always will need them in acute phases of the treatment. You don't want to have too many beds that they won't get used, or they won't get used appropriately. So yes, we have to make sure we get the master right in terms of knowing what do we need for a community of our size based on the last 5 to 10 years in terms of current trends.
Having the psychologists, mental health professionals within the doctor's practices, having more things within the community is, in other words, shifting it more to it's a semi-privatized model versus the supported by the BHB, in other words.
I think you're trying to look at a mix here. Historically, mental health services, if you come to M.W.I, there's no cost for that. We don't turn anyone away for any needs treatment. I think in the private sector, if we're providing the services, if it's covered by your insurance, great. But we certainly, again, our philosophy is the same. We don't turn anyone away who requires mental health services from any of our professionals.
And I think it's about seeing the resources that we currently have and just essentially doing things differently. But again, keeping the patient at the center, like what's the right thing for the patient? And if the right thing is to try to maintain somebody in their space, whether that be at home or in the GP offices, that's what we should endeavour to do if that's appropriate.